Have you ever gone to your doctor and walked out feeling completely frustrated about trying to see if you'd be a good candidate for hormone therapy, but he or she says no because of your family history of this or your family history of that? And you wonder, but wait a second, I'm not my family member. This is a really common thing to happen to you and to millions of other women. In today's video, I want to cover 3 really important things in your family history that you should know about and what that means for you. Hi everyone, I'm Dr. Heather Hirsch. I run the Midlife and Menopause Clinic at the Brigham and Women's Hospital in Boston, Massachusetts, where I see women on a consultative basis for all things midlife and sexual health. And it's really common that a patient will incorrectly have been told she couldn't take hormone therapy due to a family history of X, Y, or Z. It's really important to break these myths down because it's your health that's on the line. Without further ado, let's get into the 3 things that you should ask your family about. The first is probably what you'd guessed, which is a family history of breast cancer. Now, what you want to do is ask around for your family history if you can, and if this is something that your family is willing to talk to you about. There are certainly instances where you have been adopted and you don't have access to that information. You may be estranged from your family and so you can't ask them, or this information is just really sensitive to those family members. But if you have the opportunity to, definitely start with any family history of cancer, gynecologic cancers, and then onto breast cancers. When deciding if hormone therapy is right for you, you are going to want to know how many first-degree relatives and or second-degree relatives in your family have had breast cancer diagnoses. Now, a first-degree relative is a mom or a sister or a brother, and second-degree relatives are pretty much anyone else, so grandparents, cousins, great aunts, great uncles, etc. You should also know not only first degree, second degree, pre or post-menopausal, but what stage of breast cancer was it and how they were treated. All of those things are really helpful to know in making the decision. Secondly, if anyone had any genetic testing for any high-risk conditions, if you know about that, definitely put that in the mix as well. In the instance where you have a very strong, what looks like genetic or familial history of cancer, specifically of breast tissue, it might be a good idea to undergo genetic screening or genetic testing yourself. However, for most people, it's just one family member that had breast cancer. Let's say it was your mom and it was postmenopausal. This is not a contraindication to you taking hormone therapy. And the reason is that the majority of breast cancer is environmental. A very small component is genetic. And so if you don't have a very strong family history and you are really suffering with symptoms, this is not a contraindication. Number 2, ask about any family history of clots. Now, family history of clots does not mean that you cannot take hormone therapy, but it is more data to help you decide the best route or the best formulation and when to start on hormone therapy. So you're going to want to ask your family history about a history of clots, but not just clots in general. You want to know, was it a provoked or unprovoked clot? So let's start with definitions. A provoked clot means it came after something that, i.e. provoked an inflammatory state, a car accident, or immediately after a surgery. If anyone had a clot after either of those instances, that's called a provoked blood clot. And in fact, even if you yourself have had a provoked blood clot and you're otherwise healthy, you can still use hormone therapy. If you have any family history of an unprovoked clot, meaning a clot that just happened while someone was just sitting and watching TV, that's really important to know. It's still not a contraindication to you taking hormone therapy, but if there's a majority of people who are either first or second degree relatives who have had an unprovoked clot, it may be useful for you and your doctor to do some genetic testing to see if you don't carry some of the most common mutations for a predisposition to clotting. The third thing you should ask your family about is any history of cardiovascular disease. And this is not a contraindication to hormone therapy, but it is really important for you to know. The leading cause of death in women by and far is heart disease. Now, a lot of people think that it's breast cancer. It's absolutely not breast cancer. In fact, A lot of breast cancer is treatable, and so that's really helpful to know, but you should put that energy instead into thinking about any family history of cardiovascular disease. Now, that could include what you would think of like a heart attack, but also think about risk factors for cardiovascular diseases like high blood pressure, diabetes, obesity, or high cholesterol. If you have any of those in your family, it's really important to start mapping those out, because that will show you potentially where your risk really lies, be it cardiovascular disease versus other types of risks. Now, what we do know is that women who use hormone therapy within 10 years of menopause have reduction in risk for cardiovascular disease and in diabetes. And estrogen actually may even help prevent metabolic syndrome by helping women who take hormone therapy not to gain as much weight. So if you actually have cardiovascular disease in your family, hormone therapy may be in your favor. It's not uncommon that I will have a patient tell me, well, my other doctor told me because my mom had a heart attack or my dad had a stroke that I was not a candidate for hormone therapy. And really, that really couldn't be much farther from the truth. In fact, preventing you from getting a heart attack is really important, and a huge aspect of that to me is diminishing symptoms of hot flashes. Now, the American Heart Association actually also came out with a statement in 2020 showing that menopause itself is a novel risk factor for cardiovascular disease. So menopause does not exist in a bubble, and a hot flash is not just a nuisance. A hot flash can actually increase your risk for cardiovascular diseases. So in many ways, what I'm trying to say is a family history of cardiovascular disease may actually point to you actually having a more favorable reasons or benefits for taking hormone therapy. So to summarize, there's actually no absolute contraindication for you to take hormone therapy from any family history. I know that might be a hard pill to swallow, but it really is the truth. There is no evidence to show that we should withhold hormone therapy based on a family history of breast cancer or clots or cardiovascular disease. Comment below, did your doctor tell you you couldn't take hormone therapy because your mom had breast cancer or because your aunt had breast cancer? And if so, how frustrated did that make you feel? I hope this video is really helpful and shed some light on the most important family history and why knowing that is actually just powerful information for you to have. In my class, the Reclaiming Menopause Masterclass, we cover all of this and more, and I really walk you through how to go from symptomatic to symptom-free and get exactly what you need from your doctor where you are. So if you want to learn more about the Reclaiming Menopause Masterclass, definitely click the link in the description. There's a short little application to fill out to see if the class is right for you, and I highly recommend, if you are ready to take the next step, that you go ahead and do so. If not, also check out my free menopause health guide. That's also linked in the description below. If you guys didn't know, I also host my own podcast, Health by Heather Hirsch, where we talk about all things menopause and midlife. You can also see that in the description below, and I highly encourage you to flip through and see which episodes might be really relevant to you based on your history and questions or concerns that you have around perimenopause and menopause, and there's tons of sexual health information in there as well. So definitely browse through those and let me know what topics you want to hear more of over on the show as well as over on YouTube. Thank you guys so much for watching my channel. I truly love making these videos for you. I was on a break for a while as I was really recreating and putting together this masterclass. So I am back, and ideally you should be getting new videos from me every Monday. Please subscribe. That lets me know that you love this channel, you like this content, and you want to see more of it so that I can make more for you. Thank you guys so much for watching, and also thank you for 10,000 subs here on my channel. That is amazing to know, and that really tells women across the globe who are searching for answers on all things menopause that this channel is a great source of evidence-based information and hopefully really easy to digest. Thank you guys so much, and I'll see you next Monday for a brand new video.